Hello my friends, this next exercise is called the pelvic clock. I particularly use this exercise with clients who see me with acute SI joint pain or lower back pain. It's a classic from the Feldenkrais tradition. The purpose of this exercise is to relax the nervous system in order to regulate the pain response, but also to desensitize the area of your lower back and the sacrum, the sacral area, to movement. And also to connect to your deep front line. Remember, the deep front line travels from the base of your foot, up your lower leg, behind the shin bone, up the inner thigh, via the adductors, through the pelvic floor fascia, which also includes the fascia on the inside of the sacrum, and then it travels up the front of your spine, also the rib cage and the diaphragm and the heart, up through the neck, towards your jaw. And you will notice the whole body movement from the inside when doing this exercise. All you need is a pair of socks and a floor. So come into a supine position, lying on your back with your knees bent. To begin with, we're just going to breathe to allow the body and mind to arrive. Take your hands to the side of the rib cage. And whilst you're lying here, the inner thighs, pelvic floor, abdominals are relaxed. You're breathing laterally into your rib cage, breathing into your hands or fingers, into the nose, and breathe out through the mouth. And shoulders and jaw are relaxed. A few deep breaths. And then expanding the breath three-dimensionally, breathing into the back, noticing the floor beneath you, and also as you breathe in, your sternum, your rib cage moves towards the ceiling. Breathing into the nose and out of the mouth. Expansive and soft three-dimensional breath. Well-meaning to your nervous system to really slow down and arrive. Now take your socks, lift your pelvis up, place the socks beneath your sacrum. You may need to move it in order to find a nice centered place. Palms facing up, your arms out wide as much as it's comfortable for you. You may want to go into a T-shaped position, and for others it's more comfortable a little bit lower. And we begin with an anterior and posterior tilt of the pelvis. Posterior means the pubic bone moves towards the navel, anterior, the tailbone closer towards the floor. A soft movement of the pelvis. The movement should come through the pelvis. Your pelvic floor abdominals engage slightly in order to lift the pubic bone and bring the pelvis into a posterior tilt, and relax as you anteriorly tilt. Just a gentle movement, soft and flowing. And if you feel like your pelvis tips into one direction easier than the other, move your socks and try to find a middle ground so you have equal movement up and down. Notice how the movement travels through your spine. Your shoulders, jaw, cheeks are relaxed. Eyes are relaxed. Tongue is relaxed. Your breath is flowing. Continue a few more times. Then move into a centered position and begin to tilt the pelvis to the right and to the left. The knees will follow a little bit, but the majority of movement comes through the pelvis. And what we do here is we invite the nervous system to explore the movements that may signal pain, and through that we may address some misfiring. And we also massage the sacral fascia with the socks below, which also helps to desensitize this area. Now, moving your pelvis to center. Next time you move your pelvis to the right, turn your head to the opposite side. And then turn your pelvis to the left and your head to the right. And you also notice as you turn your pelvis from side to side, the spine follows with a slight rotation. The head is just a gentle rolling of the head from left to right. And find yourself in center again. Now turn the head to the same side of the pelvis. A gentle movement. There should be no rushing. It's more of a movement exploration through the deep front line. And now just finding center again. Allow your pelvis to rest on the socks. And now we begin with this sacral clock. So you may need to readjust your socks so you have a centered place again. And you bring now the pubic bone towards your navel. It's a very subtle movement. Then tilt the pelvis to the left. And then you roll down, roll the pelvis down, tailbone down towards the floor, rolling over to the right. And then the pelvis tilts back and up again to center, to 12 o'clock. And then left again. The breath is flowing. Moving your sacrum or the outside edges of your sacrum around the socks. A very subtle, gentle movement. And you may also notice how the movement travels and affects the spine and your neck. Now change direction. Sometimes one area is a little bit more sensitive, or the movement is not as easy to perform, rotating to one side or forward and back. And now come to center. Allow the pelvis to rest. Your breath flowing, abdominals soft, ribcage soft to allow the breath to flow and expand within. Take the socks away and just feel. Taking on the newness of sensations, perhaps spaciousness in the body. Some areas may feel softer, freer. Take a deep breath into the nose, out of the mouth. Enjoy.